Good morning, everyone. I am Dr. Riza Lorenzana, Chair of the Ako Para sa Bata 2020. The 12th Ako Para sa Bata is presented by the Child Protection Network Foundation and UNICEF. Our theme this year is Care of the Child Against Violence in the Time of Disease. If you are not yet following us, please do follow the Ako Para sa Bata social media accounts. Tag or mention Ako Para sa Bata and make sure to include the hashtag COVID-APSB 2020 in your post. Let me introduce the moderator of the Ako Para sa Bata webinar on violence against children and violence against women research during COVID-19 at 10 a.m. later. We are honored to have him back as the moderator of the first ever Ako Para sa Bata 2020 webinar. I'm sure you remember him. The moderator today is Dr. Mario Festin. He is a Professor 12 and Vice Chair of Obstetrics and Gynecology Department of the University of the Philippines College of Medicine. Dr. Festin is a convener of the Philippine Study Group for Reproductive Health of the National Institutes of Health in UP Manila. Our dear Ako Para sa Bata community and members of the Philippine Obstetrical and Gynecological Society, let us give a warm welcome to Dr. Mario R. Festin. Over to you, Dr. Festin.
Thank you, Rizzy. Good morning to everybody. I'm glad to be moderating today's activities. I'm also very honored to be part of the advisory board of the Child Protection Network. And the Child Protection Network Foundation has been doing a lot of good work for this very important and relevant webinar, which is on research on violence against children and women during the times of COVID-19. And for those who have joined the previous Ako Para sa Bata webinars, welcome back. And for the 16% who have had the perfect attendance, I hope you sustain it till the very end next week. For first-timers, welcome to the Ako Para sa Bata community. We have presently nearly 850 and growing members in our Zoom account, and we have joined by just as many in our Facebook Live. So on behalf of the Child Protection Network Foundation and the UNICEF, we are deeply grateful for your continued support. So tayo para sa bata. These are the objectives of the session: to highlight the importance of the evidence to guide policies and programs addressing violence against women and children, to describe various forms and essential elements of data collection on VAW and VAC, to discuss the ethical considerations of data collection on VAW and VAC during the times of COVID-19, to present the safety protocols during the pandemic when conducting in-person data collection, and to provide ethical and methodological guidance for research on VAW and VAC during the pandemic and other public health emergencies. I am very happy to be assisted by a co-moderator, Dr. Carmela Faustin C. Indoyon, who is part of the Monitoring, Evaluation, Accountability, and Learning, or the MEAL, officer of the Consuelo Zobel Arger Foundation. She will introduce the speakers for this part of the seminar. And I will see you later during the open forum. So over to you, Carmela.
Thank you so much, Dr. Mario Festin. I'm not yet a doctor yet, but I hope to be soon, just like you. Our first speaker today, everyone, will present challenges in doing violence against women research during COVID-19. She is a fellow in ambulatory pediatrics and is a part-time consultant at the Philippine General Hospital Child Protection Unit. She's also a pediatric palliative care provider at the Ruth Foundation. To discuss challenges in violence against women research, let us all welcome Dr. Marian Joy Naria Maritana.
Good morning, everyone. COVID-19 brought about several things in the world, such as illness, physical isolation and lockdown, loss of jobs, leading to poverty, stress, leading further to mental health problems, such as depression and anger. All of which, according to Peterman et al., are possible mechanisms that connect pandemics and increase in violence against women and children. With all these consequences of the virus itself, COVID-19 pandemic poses unprecedented challenges to individuals, families, and societies around the world, and even on doing researches on women and children. Good morning. I am Marian Chainaria Maritana, a fellow of the Ambulatory Pediatrics and a part-time consultant at Child Protection Unit of the Philippine General Hospital. And today I will be talking about the challenges in doing researches, especially on violence against women during COVID-19. So for today, here are our objectives. At the end of this lecture, we would be able to evaluate the different challenges encountered in doing research, including violence against women during COVID-19, to analyze the ethical considerations and to apply these ethical considerations and guidelines in conducting researches involving women during COVID-19 pandemic. So, let us begin our discussion for today. So now we begin with the challenges in doing research during a pandemic based on an article by the UNICEF Remote Data Collection on Violence Against Women during COVID-19, a conversation with experts on ethics, measurement, and research priorities. Challenges mainly is brought about by the strict restrictions due to the COVID-19 containment and prevention measure. Such restrictions gave rise to logistical challenges, such as challenges from physical distancing and lockdown, where we are prohibited from doing the usual face-to-face interviews or are limited in doing the face-to-face interviews. Also, we have lack of necessary equipments on the respondent side, wherein the respondents has no access or may have no smartphones or laptops or computers which we can contact them. Moreover, they may have also problems in internet connectivity, which is very prevalent in our country today. And moreover, they might have no money also to buy load for data or even to make calls or SMS to reply to our messages. With all these logistical challenges, our research may be difficult to carry out and cannot safely get and reliably get data. So due to logistical challenges of lockdown and physical isolation, training research staff on research protocols such as how to properly do an interview with women respondents is also challenging. So as you can see, training of research staff is needed since for remote surveys, check-ins, and signals of distress are not automatic among respondents and interviewers. So there can be nonverbal and body actions that cannot be seen in a remote data collection, especially if it is done via phone call. Hence, interviewers needed to be trained in protocols on how to give instructions, ask questions, or even detect any issues arising on the respondent side. During a pandemic, we converted from face-to-face training sessions to online sessions using different virtual platforms such as Zoom. Moreover, another challenge in doing research is safety of both the researchers and the participants. Due to COVID infection, doing face-to-face research may expose both researchers and participants in either acquiring the COVID infection or be the one to spread COVID infection in the community. For researches on violence against women, women may be staying at home with their abusers, which brings safety risks in conducting remote data collection. In an article in UNICEF, some of the recommendations were not to include direct questions on violence against women experience within population-based rapid assessment, and most importantly, to do a risk-benefit analysis for your study or problem. One question posed in this article was, is it necessary or possible to safely collect violence against women or VAW measures given the risks and ethical challenges? Sa palagay niyo po, pwede kaya ito? So one question posed in the article was this question, and that according to Henriette Jansen, we can only collect data when you can collect data safely, when it is clear, malinaw, what it means and what not, or malinaw yung goals natin, and when it is actionable, may magagawa tayo to promote safety. We must get our priorities right and support vulnerable groups despite the pandemic. So now we go to the ethical considerations in doing research during a pandemic. Are we still okay? Okay. So the first ethical consideration are confidentiality and privacy of the participants. For this, experts recommend interviewers to schedule interview with respondents when they will be able to be in a quiet and private place instead of conducting the interview whenever someone picks up the phone. So it is very important to ensure participants are instructed to be in a place where no one can hear them or exchange of messages cannot be read by other people, even their children. So for example po, pwede nating sabihin na, ma'am, maaari po ba kayo pumunta sa isang lugar na kung saan wala pong ibang taong makakarinig po sa ating pag-uusap? O kaya po, maaari po bang i-ensure po natin or siguraduhin po natin na ang ating cellphone po ay hindi mababasa or ating mga mensahe ay hindi po mababasa kahit na po ng ating anak. And lastly, they suggest to ensure eligibility requirements to participate among participants. So we can ask the respondent to have access to a phone inaccessible by other people, especially if there are potential abusers in their home. So we can say, ma'am, mayroon po ba kayong sariling cellphone po or makakakuha po ba tayo, makakahiram ng cellphone na kung saan po ay tayong dalawa lamang po ang makakarinig sa isa't isa po. Okay. Another challenge is the participant safety. The ethical considerations on privacy and confidentiality further ensures us that the consideration of participant safety is also ensured. So when we see participant safety, for example, for VAW, it's the safety of the mothers or the women. So for example, safety from further potential abuse from the abusers inside their home. So as interviews are conducted and seen by potential abusers, he may become suspicious on such calls made or sa mga interview na ginagawa po natin. Other people may forcefully demand the children to say something about the calls or even read and trace the messages sent via phones or internet websites. So aside from the previous recommendations in ensuring privacy, which could contribute greatly to participant safety, some experts recommend that if access to safe equipment is not possible, we safely provide referral numbers or hotlines for support. In short, yung mga numbers po na kung saan pwede po silang tumawag kung meron pong mga ang kanilang kaligtasan po ay nasa panganib or sila ay nasa panganib. Okay? And also, we train interviewers to work with respondents to quickly change the subject when someone walks in the room or provide a safe word that can be said to signal the interviewer that the interview need to be continued later. So for example po, ang safe word po natin na ituturo natin sa participants natin, pag sinabi ko po pag sinabi niyo po sa akin na hindi po ako mag-order ng Lazada or hindi po ako nag-order sa Shopee, ibig sabihin po signal na po sa akin yun na may tao pong paparating at kailangan po nating i-pause muna or i-stop po muna ang interview. So the safe word should also be safe to be said and to signal the interviewer. The interviewer should be noticing that the safe word has already been said. And lastly, establish referral services such as child and women protection and counseling and social services in the community as needed by the participants. So another ethical consideration is giving and obtaining informed consent. So it is important that respondents understand what they are participating in and that researchers will be able to document how they obtained their consent in participating. Due to COVID-19, face-to-face explanation and actual signing of informed consent may not be feasible and safe. Recommendations include obtaining graduated informed consent following the WHO guidelines. In this way, the initial person who answers the telephone is provided general non-specific information about the survey topic. So specific topics are only revealed to individual respondent who has been randomly selected to participate in the survey. Since informed consent are obtained remotely, it should be written using the simple and understandable statements translated in the respondent's language. For example, Tagalog. And lastly, document that informed consent was obtained and how it was obtained. So, another ethical consideration is on staff safety. As you can see, some staff may have previous experiences on the topic of the research. Excuse me. Excuse me po. And then, some staff may have previous experiences on the topic of the research. For example, the interviewer might have experienced violence. Okay po. So, for example po, or simply, meron silang unpleasant encounters with the participants. So, for example po, may mga participants na bigla na lang pong hindi maganda yung sasabihin or nagalit for whatever reason. So, we have to train them also on how to respond to it. So, experts mentioned the importance of regular check-ins and debriefing to ensure interviewers' experiences are processed and that they would feel the team support. Okay, with all these challenges and ethical considerations, how then do we consider it and apply the recommendations in doing a research during COVID? So, paano po kaya? Medyo madaming challenge, madaming considerations po. Paano po kaya? So, tingnan po natin yung isang research protocol na entitled Psychosocial Effects of COVID-19 on Families with Young Children. So, tingnan po natin how these challenges and ethical considerations were considered and were done well. Okay. So, the study problem in this research protocol is among mothers with young children, what are their experiences, impact on relationships, and coping mechanisms during the COVID-19 pandemic? So our population are mothers. So they are of adult age, so wala pong 18 years old and below. And then in general po, mothers sila and women mothers po na in a certain area. The outcome that we wanted to have are the experiences, impact on relationships, and coping mechanisms of these mothers during the COVID-19 pandemic. As guidelines in doing researches during a pandemic would say, it is very important to determine and weigh the relevance of the study. So yun yung pinakauna nating tanong. So relevant ba yung study? Nagawa na ba yung study? May other data na ba na nakakapagsabi dito sa study na to? So yung research protocol po na ito aims to help determine and give solutions to the gaps between mothers' needs and challenges and interventions provided. So gusto nating malaman, ano po ba yung status ng mga parents during COVID-19? Ano yung mga pwedeng pangangailangan nila mula dun sa data na nakuha natin? Or ano po ba yung challenges? Or ano po ba yung mga nakukuha nila? So this also could be an avenue to design interventions for self-care, good coping skills, and even positive parenting. So another aim or relevance of this study is that this could also provide advice on how to advance locally adopted policies and create environments supportive of families with young children. So all in all we wanted is to contribute to a better environment during a COVID-19 and to support these mothers. So now we go to the challenges and ethical considerations encountered in this research protocol. So the first challenge or ethical consideration is that restrictions due to COVID-19 containment and prevention measures. To ensure the safety of the participants and the researchers as well as the community, we adopted and converted data collection from face-to-face to telephone calls by trained interviewers. The call will be made by the interviewers, hence, no expenses will incur in the side of the participants. Another challenge is that we are doing remote data collection. So phone call interviews may be more difficult to be understood. Kasi mas mahirap po yun. We have a problem with signal. Tapos po, sometimes the noise in the environment is not manageable enough. So medyo mahirap po talaga siya. So what we can do at least is that we translate all forms in Tagalog para naiintindihan po ng ating mga respondents. So depende po sa language ng participants, and that all the statements are simplified. So the translation po that we did or in this study is that we follow the guidelines set by the World Health Organization, and then we can do to ensure that it is understandable by other people, then we can pre-test the forms. So another challenge or consideration is privacy and confidentiality may be compromised. So hence, as was discussed earlier, the participants can be asked to go to a quiet and private area where there is no other person or interruption and can use a headset. Okay, excuse me po. And then, interviewers will also conduct the phone interview in the same manner. So, yung interviewers din po, naka-headset, and then nasa area din po, na wala din pong ibang tao. Okay. Excuse me po. Inom lang po akong water. Okay, next po would be the informed consent. Despite collecting data remotely, an informed sheet containing details of the study goes with the informed consent to help the participants understand what they are participating in and who they can contact in case they have concerns. So like the other forms, the informed consent should also be translated in the language that can be understood by the participants, which is Tagalog. So you might be asking po, paano natin makukuha yung informed consent on a remote setting? So in this protocol, the informed consent will be sent po via electronic message, and at the same time, it can be sent back with the signature of the participant. So if it would be hard po, we can record po the informed consent given or obtained with the phone call that we did po with our participants. So we record the phone call also with the consent of the participant. And then another challenge or ethical consideration is the safety of the participant. So previous items contribute to patient safety. So to add, we also added contact information that can be reached for complaints for the participants if they have some complaints in the informed consent. So participants would know who to contact if they have complaints with the interviewers. And moreover, hopefully po hindi naman magkaroon po ng problems, so we train po yung interviewers natin. We train them in conducting interviews, respond to questions and answers, and also on referring to referral services. So, ang isang challenge naman po, meron tayong referral services, pero may be restricted po or limited. It depends on the kunwari, GCQ po ngayon or enhanced community quarantine. So these specialized services may be limited. So baka mahirapan po tayo mag-refer. So it is really very important that referral and emergency protocols are in place and that they are coordinated with the service providers in the community close to the participants. So we move on to the other challenges and ethical considerations pertaining our data. So first is the data management. So in the data management, data should be managed using standard security methods to ensure also privacy and confidentiality. So here are some of the methods that can be used or will be used in this research protocol. And then another one is the data storage. So aside from using these secure methods, we are also noted that the personal identifiable data will be accessed by only certain people, and some the identified data will be accessed by another group of investigators. So this means that it will be stored for the entire duration of the study, and it should be clear also to our participants that it will be stored for a maximum of 15 years. So data sharing, sino po yung pwedeng mag-share ng mga data natin? So in this protocol, it may be only shared by the investigators and the governing research institutions. So ito lang po yung mga pwedeng mag-share. However, yung personal identifiable data, only few people can see it po, and it wouldn't be shared po. So let us move on to other ethical considerations, which include staff safety, potential risks, and benefits. So for staff safety, staff will not be exposed to any risk to their health or security during the conduct of the research. However, in any case that problems would arise in the telemed or remote data collection setting or during phone call interviews, interviewers will be trained in awareness and safety measures. Meetings with interviewers shall be conducted to discuss any experiences and any problems. So, for potential risks, there is no immediate risk for participants and research staff. However, there could be possible emotional discomfort associated with some of the questions in the study. Hence, again, interviewers shall be trained to respond, and all the research staff to respond and refer to specialized services as needed, and referral system has been coordinated. So for the participants and also for our interviewers. For the benefits, all participants should get the same incentive regardless of time spent. So, for example, you think about giving an incentive for participants, then we give the same incentive for all the participants, regardless of how long the interview was conducted. So this is to ensure that there will be no other ethical issues that would arise. And furthermore, it is noted that there are few risks. However, the future potential benefits to the society of this study are substantial. So yun po yung pinakamahalaga for us to decide to continue with the study. So in summary, COVID-19 pandemic poses unprecedented challenges to individuals, families, and societies around the world, and even in conducting researches. Madami po talaga ang challenges na ginawa si COVID-19. However, we can adapt and adjust po with COVID-19. So to ensure relevance and adherence to safety protocol and ethical principles, data should directly contribute to improving well-being of the people. In example, women while ensuring, in example, women. So while we ensure safety and integrity at all times in preparing for the research, in conducting a research, and even in doing a research results and discussion already. And then lastly po, it is very important to collaborate with the experts, such as experts in violence against women or experts in the topics that you chose. And also, it is very helpful if we submit for review and approval from any certifying body as the as for example, the UP Manila Research Ethics Board. So this study protocol din po was submitted in the UP Manila Research Ethics Board, so we can see po and ask opinions from the experts on ethics and in researches even during the pandemic. So, we are nearing po the end. So, let me end with this statement po from UNICEF, Guide to Inform Ethical Data Collection and Evidence Generation. A reminder for all of us who are planning to do researches or who are doing researches already during this pandemic, especially if our topic is on violence against women. It is very essential to adhere to well-established and standard principles and protocols for ensuring the safety and confidentiality of participants and even the researchers. With this po, thank you and good day. And here are my references for this report or lecture po. Thank you po.
Bigyan sa tulong, siya pa ang galit. Tulong dapat ibigay, di pinipilit. Pag nangutang na
Thank you
maluwag.
so much, Dr. Marian, for sharing very helpful and practical tips that we all can follow to ensure the safe and responsible conduct of research involving violence against women. Maraming salamat po, and we'll be sure to follow all of them if ever we do decide to partake these kinds of studies. So now let's move on to our next presentation for this morning. Our next speaker is a consultant at the Philippine General Hospital Child Protection Unit as well. She is a member of the Child Abuse, Neglect, and Exploitation Study Group of the UP Manila National Institutes of Health and is also the Director for Research of the Child Protection Network. And she is also an instructor at the University of Santo Tomas, Faculty of Medicine and Surgery. So to discuss the challenges in conducting violence against children research, let us all welcome Dr. Sandra S. Hernandez. Take it away, Dr. Sandra.
Thank you, Mela. Thank you. Good morning, everyone. Good morning to our ever loyal APSB community and to our guests, the obstetricians and gynecologists from POGS. Congratulations po. For my part this morning, I will be sharing with you the challenges encountered when doing violence against children research during the COVID-19 pandemic. At the end of this short lecture, I hope that we all have a better understanding of the importance of doing research on VAC, special ethical guidelines for doing research in general involving children, and these ethical issues when doing research specifically on violence. Most importantly, safety and ethical and methodological considerations when doing VAC research during the COVID-19 pandemic. So to start, I would just like to highlight what has been mentioned already during the introduction by Dr. Fistin, that we need health and health-related research because it generates evidence to help us design and implement services, policies, and programs. However, involvement of human participants in health research results in risks. And so we have these ethical guidelines to ensure the protection of the rights and safety of all the human participants involved in research. Basic elements of research for those who are not too familiar with research first includes social value. So basically this means that the research you are doing should be relevant to the health or social problem one is investigating, and that you produce results that will be useful. The next is informed consent, which you may have heard already from Dr. Marian. Informed consent is the decision of a competent potential participant to voluntarily participate without being forced or coerced. We consider the vulnerability of research participants, and this is what we need to emphasize in doing research with children, because we have populations who are unable to fully decide for themselves if they will participate in research. So they need special protection. Risks, benefit, and safety are very important to consider. Research is not justified if it will not result in benefits for society. There must also be a positive benefit-risk ratio. Privacy and confidentiality, you may hear a lot, but these are two distinct terms. So privacy is the right of an individual to have his or her health information kept private, while confidentiality is the duty of anyone who has been entrusted with this information to keep that information private. So we will be discussing about this later on. Justice is fair selection. In research, you have equal selection or fair selection of participants, of assigning interventions. No one must be left out when assigning treatments, for example. And then lastly, transparency is the duty of a researcher to be transparent to the respondents about all aspects of the study, which will have an effect on his rights, on his health, and on his safety. So these are taken from the National Ethical Guidelines for Health and Health-Related Research, which can be downloadable from the internet. Now, with regards to conducting research among children, there are special guidelines in this same document. One is the concept of vulnerability. So as we all know, minors are persons or children under 18 years, and children are considered a vulnerable population. Therefore, the guidelines says that vulnerable groups shall not be included in research unless you cannot do the study among adults. For example, if it's violence against children, of course, there are studies among adult survivors of violence in childhood, but there are also studies that involve children specifically. And then also, research is justified if the aim is to obtain knowledge that is relevant to the health needs of children. Another important special concern when doing research among minors or children is informed consent. So this is the requirement. It is required that you get permission from a parent or legally authorized representative. There is also the issue of assent. Assent is the manifestation, so it can be written or oral, of the agreement of the minor to participate in the research. For 12 to 15 years old, the children are requested to sign a simplified assent form, while for those 15 to 18 years, they may co-sign the informed consent form that was signed by their parents. What is important about informed consent is that if a child refuses to participate or continue, let's say the child has started and then midway decides that he does not feel comfortable anymore, then you have to respect that, even if the parents gave their consent or originally gave their consent. So violence against children is a public health problem, and it requires a public health approach. The public health model starts with defining the problem. This means that we understand the who's and the what's and the why's, the how's of the problem. We can get this information from household surveys or even from statistics from service providers like the PNP, WCPUs, or DSWD. The second step in the public health model, is the identification of who is at risk or those who may have protective factors. The third step is using these findings to develop and test prevention strategies. And the fourth step is implementing, evaluating, and then scaling up so that you have widespread adoption of the tested strategy. In violence against children, there are various sources of data. You have quantitative data from surveys. So this is basically prevalence data, how many are affected. We also have qualitative data where you seek to understand the dynamics or more in-depth, where you seek more in-depth understanding of violence against children. So you can get this from focus group discussions or interviews of caregivers, children, or other household members. We are familiar with administrative data because this is data from service providers like, as I mentioned, WCPUs, PNP, the Women and Children Protection Desk, and DSWD, or even from hospitals. And then fourth is something I just encountered. They call it big data, which we can obtain from social media platforms and search engines. In violence against children research, we usually make use of these two sources of data. However, there is a limit to data from service providers because we know that this is just the tip of the iceberg. The patients that we see, for example, for us in the Child Protection Unit, are only those children who disclose or whose cases are reported or acted upon by their parents or um, concerned citizens. But we know that there are a lot out there, that we don't see. um, as you know from the NBS VAC, there is an overall 80% prevalence of child maltreatment in the Philippines, and that 3 out of 5 children are physically abused. In the Child Protection Unit, we only see very less of these children. So there is a discrepancy. Okay, so speaking of household surveys, in 2015, the National Baseline Study on VAC in the Philippines was conducted, led by the Council for the Welfare of Children and Partners. So this is a national household survey that measured prevalence. It gave prevalence estimates for the types of violence. Also, it provided information on health outcomes, risk and protective factors, and service utilization. The NBS VAC is actually a takeoff from the VACs studies that are led by the Center for Disease Control and Prevention. As of, the website states that their VACs has been implemented in more than 24 countries already. For us, the NBS VAC was a mixed method data collection. So it involved a household survey plus interviews of stakeholders. It was a face-to-face interview in a private setting done by trained interviewers using a pencil and paper questionnaire. And 3,866 children and youth aged 13 to 24 years were involved. You might wonder why the VAX sets this age bracket. So according to the VAX write-ups, the age 13 is because younger children will not be able to sit through an interview. The questionnaire is pretty long, and because they may not yet fully understand their rights as a participant in research. And then most importantly, they may not be able to answer yet the questions that are sensitive, like questions asking about sexual history and sexual risk-taking. The upper limit of 24 years consider the fact that the farther you are from a childhood experience, then the less likely you might be able to recall that experience. So they set the upper limit at 24 years. Now we have the ethical considerations, basic, and then you have ethical considerations when doing research involving children. There are special risks now, particular to doing VAC research. One is the safety of respondents and field teams, which Dr. Marian also mentioned in her discussion on VAW. So past studies have shown that when perpetrators find out that you are doing a study on violence in the community, they may retaliate against the respondents because simply for participating in the survey. And then the field teams also become at risk for retaliation or punishment. And the other major issue with VAC research is that you have questions that ask sensitive questions like those on sexual behavior and risk-taking, and then of course the experience of violence, victimization, and also being a perpetrator of violence. And so we come to the impact of COVID-19. COVID-19, as we know, has given us many restrictions. You have quarantine measures, mass gathering and travel restrictions, physical distancing, and their PPE requirements. So in the process of designing a study during this pandemic, we realized that all of these COVID-19 response measures also affects research procedures and ethical considerations. So we have layers of ethical considerations to tackle. You have those of research involving minors, ethical issues of doing research on VAC, and then these new challenges and dilemmas that COVID-19 brought about. So this will be the highlight of the discussion. To understand the impact of COVID-19 on research, I will use, as Dr. Marian did, a study protocol, the Child Health and Safety Survey, that was designed during the COVID-19 pandemic. So this is supposed to be a citywide survey that includes questions on VAC. It is actually a local adaptation of the NBS VAC. And planning started right before the lockdown. We started talking in February, and then the lockdown happened in March. So throughout the lockdown, there had to be continuous modifications of the protocol as we learned more. And then finally, it underwent full review by the University of the Philippines Manila Research Ethics Board in October. So we are working on the modifications that have been recommended by the panel. A major difference between the NBS VAC and this study is that we are going to do a computer-assisted self-interview. Instead of a pencil and paper questionnaire, we are going to make use of an application on a tablet computer. And of course, unlike the NBS VAC, we will be including COVID-19 questions. So I will go through the VAC's ethical considerations and then show you how COVID-19 has affected these issues. So for VACs, with regards safety of respondents, the first step is you have to orient the city stakeholders, introduce the study to the community and household members. But in the process, we try to frame it in a generic, using a generic title. We try to avoid, or we have to avoid using the word violence, abuse, and rape for the reason mentioned earlier, that you have to protect not only the respondents, but also the field team, the field interviewers. So what COVID-19 adds to this is because of the mass gathering and travel restrictions that basically affects the orientation. So we are planning an online orientation of city stakeholders. Other ethical considerations with regards safety is the split sample design. So this is a feature of the VAC study where you have separate geographic areas for male and female so that there is less chances that a perpetrator and a victim will be sampled in the same community. We also select only one respondent per household to ensure that, again, that you don't end up sampling a victim and perpetrator in the same household. The interview has to be conducted in a private setting. So that goes for either pencil and paper, telephone, or computer assisted. And then informed consent and time limit, where we only allow the field team to stay in a community for a limited period of time. It's the private setting that is most affected by COVID-19 because how can you conduct an interview, a face-to-face interview in a private setting when you have the GCQ? You might be involving a high-risk individual as a household respondent if she is a senior already, and because you need physical distancing. So for the child health and safety survey, we considered all of these things, the privacy and confidentiality, the informed consent process, which I will discuss later. And we created a COVID-19 safety protocol. So this COVID-19 safety protocol was designed specifically for this study, adapting many of the guidelines that you are familiar with. So if the VAX is a face-to-face paper-based interview where it was administered or assisted by an interviewer, the child health and safety survey is also face-to-face, but it is computer-based and it is self-administered. If you look at literature on doing research on COVID during COVID-19, some references, for example, from UNICEF will discuss remote data collection. This can be done through a telephone survey like Dr. Marian's or through a website online. However, if you go to the reference by UNICEF, you will realize that this is really not advisable because there are many ethical issues that You will not be able to address, for example, the issue of consent is hard to get when you cannot see the parent and child. Privacy, you cannot ensure when you cannot see the parent and child. Safety is hard to assess when you cannot see the parent and child. So we stuck with this face-to-face, computer-based, self-administered mode of data collection. If this was the pre-COVID-19 household survey done by the NBS VAC, this is what we hope to be able to achieve, or we need to achieve, with the child health and safety survey. So with this, you have field team undergoes a health declaration check and temperature check. We also provide transportation because of the limits of transportation. Physical distancing is ensured, and the field team, the field interviewers, as well as the respondents will be provided personal protective equipment, hand hygiene, we will be giving alcohol, and RT-PCR for symptomatic research team members. So all of these aspects of the safety protocol also had to be considered when we were creating the budget for the study. So we go now to the other ethical issues, which includes the profile and training of our field interviewers. So this is very important for the VACs because you need to carefully select experienced interviewers. In the selection, you need to consider that they are sex matched. So you have to assign a male interviewer to a male respondent. You have to make sure somehow that they do not have experiences of violence, and then that they are computer literate and they are not known to the community where they will be doing their interviews. The interviews also need to undergo in-depth training covering all aspects of survey administration. For the VAX guidelines, they actually recommend 100 hours for the team leader and 100 hours also for the field interviewers. How does COVID-19 complicate this? With the restrictions, we cannot do the workshops. So we will resort to blended training where you have synchronous and asynchronous modules. But we still are thinking of maybe when the time is right, we will still be able to do face-to-face workshops because the training of the field team requires role playing and other interactive activities. But this is something that is still being considered. Another ethical issue, as Dr. Marian has discussed, is informed consent and assent. For VACs, we know that it has to be voluntary without coercion, and they give this only after full understanding of the risks and benefits. For minors, we need parental consent and that you have a respondent consent as well as assent form. COVID-19, according to UNICEF, complicates this because not very much the process, but the fact that the parents and guardians may be more vulnerable to incentives or exploitation by data collection agents because of the economic effects of COVID-19. How we seek to address that is by providing the incentive, after completion of the questionnaire. And the incentive is not in cash, but in kind. And we are planning to give them very useful things like a face mask and face shield and alcohol. We will also be providing snacks. Well, privacy and confidentiality issue in VACs. This has been emphasized repeatedly that the interview needs to be conducted in a private setting. The field workers will sign a confidentiality agreement. They follow a strict community and household entry protocol, and no personal identifying information is collected. Among these, COVID-19 complicates most the need for a private space because in quarantine situations, again, according to this document from UNICEF, especially in crowded dwellings, the conversations may be easily overheard. This may be lessened, of course, because we will be using tabs or the app on the tab. But still, in a crowded situation in a crowded dwelling, it's very easy to be able to see what the other household members are doing. Sometimes, of course, the gadgets are also shared among family members. And so, our solution to that is the interview will not be conducted in the house. The study relies heavily on partnership with the local government or with the city government. So we need to work with the barangay to be able to identify a venue which should be safe, accessible, and of course, along with the COVID-19 considerations like open air or well ventilated. And one example of this would be, for example, the barangay health center or a daycare center. Okay, another important aspect of doing VAC research is safety, support, referrals, and mandatory reporting. The VAC's ethical considerations um, require the interviewers to be trained to identify signs of distress. That's why we can't do just online. That's why there are role playing workshops, because interviewers need to be able to identify, even from a distance, if the respondent is upset just during answering of the questionnaire on the tablet. The interviewers are trained also to provide a comprehensive list of support services. So this won't only be about violence, but a full range of support services, even educational and livelihood, to the respondent. There should also be a referral plan for both VAW and VAC, because you might have a mother who is um, there might be domestic violence, and of course the mandatory reporting protocol. So these are all essential critical elements of doing VAC research. COVID-19 complicates this because, especially during the earlier months of the lockdown, safely and timely services were not available or accessible. Travel restrictions were also more strict. In fact, in the CPU in April, we almost had no patients at all. Health seeking behavior is also changed by COVID because people don't want to step out of the house because of the fear of becoming infected. So, what a study needs during this time is the presence of a WCPU in the area, or if none, at least coordination with CSWDO, the City Social Welfare Office, the Women's Desk, or a local hospital, and to structure a referral and a response plan so that you are sure you can provide safe and timely services. Lastly, an important ethical consideration is the use of data, which Dr. Marian has also emphasized. You cannot do research if you are not going to use the data. So there should be from the start a clear plan on how the data will be used. For COVID-19, the data must be actionable and acted upon for immediate COVID-19 response, because that's essentially why you're going to do the research. And so this will only work if you have, again, a close partnership with the city government. Of all the ethical considerations, and given all those risks that you will subject the field team and the researcher, the respondents to, this is the one that you need to be able to meet, because your research will not be justified if you don't have this. So because of the privacy and safety considerations, it is more difficult to do research amid the COVID-19 related restrictions. And in fact, primary data collection, that means doing the collecting data from children and from family members, should be avoided. However, the protocol that we are proposing is a face-to-face still, but computer-assisted, self-administered survey that includes questions on VAC. It will be implemented during the GCQ, hopefully in December. This would have been more difficult if it were done it would be impossible to do this in April or May. But we have aimed to address all ethical and safety issues in preparation of the research protocol. So to end, I would like to emphasize the importance of research. With COVID-19, what we know actually is now the tip of the iceberg. And this is the data that we have. We don't know what else is going on out there. So we need data. From household surveys, we need research. We need research that has been ethically approved, and that is all. Thank you.
Bayaran na sapat at huwag mabibitin. Whoa!
Wow, thank you so much, Dr. Sandra. It's always lovely and enlightening every time I leave a conversation with you. And I'm sure with the very concrete guidelines that you provided with us today on conducting violence against children research, especially that part about creating a referral plan and a response plan during signs of distress. It's very, very critical in upholding the rights and the protection of children, not just in research, but in any kind of situation. So thank you very much for that. Very, very enlightening and helpful. Um, let's now move on to our reaction. We have a very lovely and also enlightening person with us today. It's always lovely to see Dr. Jojo Mantaring. He is a professor and chair of the Department of Clinical Epidemiology at the College of Medicine of the University of the Philippines, Manila. So to give his reaction to the two presentations, let us welcome Dr. Jacinto Blas V. Mantaring. Take it away, Dr. Jojo.
Uh, Hi, thank you, Carmela. Um, Actually, I cannot, how do you say, I cannot say that I'm an expert on VAC or VAW. In fact, my engagement in VAC and VAW only really started in 2019 when I was engaged by Carmela and the Consuelo Foundation in organizing a ethics workshop. No? And at first, I was very reluctant to be involved. However, idol ko si Bernie Madrid. And of course, I thought to myself, I'm a clinical epidemiologist, a pediatrician, and a research ethicist. So why not? So anyway, so that's my disclosure. I'm the chair of the Single Joint Research Ethics Board of the of the Department of Health. I'm also the overall chair of the UP Manila Research Ethics Board, a member of the Health Technology Assessment Council. I am also an investigator, right now a sub-investigator of an ongoing epidemiologic study on RSV, and a member of the Speakers Bureau of Wyeth Nutritional. And I thought that for my reaction, I'll take a more general view. The speakers, by the way, I would like to congratulate both speakers for an excellent presentation. I'm not very used to researchers being the ones giving lectures on ethical considerations, but now I have just increased my pool of potential speakers for future workshops and conferences. So, Dr. Hernandez, and please accept my invitation in the future. So as I've said, I'll be taking a more general perspective because our two excellent speakers have taken a more specific perspective. So all my reactions will actually be applicable to all researches, but hopefully the audience will appreciate ethics in general as a result of my reaction. So my reactions are very short and they are all in general statements. So my first statement is that researchers mean well, but often forget that the welfare of the research participants should take precedence over the scientific interests. For those who are not very familiar with ethics guidelines and the history of ethics, physicians and researchers have a long history of ethical misconduct, I would say. It dates way back in the 1800s, actually even probably before that, but it really came into mind during the Tuskegee syphilis study. I don't know if you are aware of that study, but it was a study that looked at the natural history of syphilis among the poorest of the poor in Tuskegee, Oklahoma, which is one of a predominantly Black and illiterate population. Well, the atrocity that was committed in this study was that long after penicillin has been discovered to be effective in the treatment of syphilis, the participants of the studies were never treated. The reason because the outcome of this study was to look at the natural history of syphilis. And so if you treat syphilis, how will you appreciate the natural outcome or the natural history? So they were never treated, and that led to congressional investigation, and it led to the creation of ethics codes, which are contained in the Belmont Report. And the Belmont Report is the report that first um, coined the terms respect for persons or respect for persons' autonomy, uh, beneficence, and justice. So yung walang kamatayang tatlong ethical principles na yan came from the Belmont Report. Okay, so that's okay. My next reaction is the Philippines has robust ethical guidelines. And I'm very glad that Dr. Hernandez showed us the ethical elements as contained in our National Ethical Guidelines for Health and Health Research in 2017. Just this year, the FREB, the Philippine Health Research Ethics Board, has come up with an research ethics workbook. So it may be unknown to most researchers but we have very robust ethical guidelines, more robust than many other countries. But there are no decahon rules when it comes to violence against women and violence against children. The ethical considerations have a lot of considerations, and it's mainly on a case-to-case basis, which is why, well, before that, so our ethical guidelines already talk about social value, the informed consent, so this was already discussed. But perhaps the most important ethical consideration for any research, not only on VAC and VAW, is social value. What does social value mean? It means that the research that's being conducted addresses a very important knowledge gap. So you cannot do researches if it is not important, and you cannot do researches if it will not benefit the research participant directly, or in minimal research, which may not protect the research participant directly, at least there should be societal benefits, and that's social value. And the rest, I think, can go without very much, the rest of the elements can go without very much detailed explanation. Okay. Research ethics committees take up the best interest of the research participant. I want you to understand that there are many stakeholders when we do research. The researcher has interests to protect. Why do people do research? No? For faculty members, it's for promotion. Maybe some for researches involving drugs and drug development. Then the research is supposed to well, the researcher is paid to do the research, so may interest yung researcher. And most of the time, the research participant has also interests. For a clinical study, patients want to get better, or sometimes they really have altruistic purposes and they want to contribute to science. And you have to think, what's in it for the research participant? So when you involve a child in the research, what's in it for the child? I think that's very important, because your research shouldn't stop with just the research. It should be having social value. It should eventually redound on the welfare of the child. And not only should you be thinking of societal benefits, but there should be individual benefits as well, or direct benefits to the individuals involved in the research as well. So because researchers have their interests, and because research participants have their interests, who will protect the research participant? So of all the stakeholders of research, it's the Research Ethics Committee that takes up the best interest of the research participant. I don't see any personal benefit to my being a member of a research committee, or being the chair for that matter. I mean, I don't think, of course, we're paid not to, but I don't think we're even paid enough, and we always are at risk of litigation and complaints. Even our best friends sometimes hate us when we delay the approval of any particular research. No? So it really makes more enemies than it makes colleagues. But the research committee is the most, quote unquote, disinterested of all of the stakeholders of research. So you have to understand where we're coming from. We are not supposed to be detrimental to research. We are for the participant protection. So if it takes long for your research to be approved, it's okay as long as we protect your research participant. So as I've said, research ethics committees are all about research participant protection. So you have to ask yourself, what are research participants at risk of? Well, at the very least, loss of autonomy because they may be coerced into research, undue inducement, so yun. Then risks of the study itself in health research. For a drug trial, there can be adverse reactions to being in a drug trial. Risks of VAC and VAW, I'll talk about that later. And now, even risks of COVID-19. So with this COVID-19 pandemic, research participants are doubly at risk. Not only at risk of participating in a research, but at risk of contracting perhaps COVID while participating in a research. So I always say, if the risk of COVID is higher than the benefits of the research, because this is a research and because research is optional, then why not postpone the research? Or the more prudent thing to do among us members of the Research Ethics Committee is to disapprove the research until the benefits outweigh the risks, or until you can put the safeguards that will put the research participant as well as the researcher at a lower risk of COVID during research. VAC and VAW research participants are often victims that need double protection. So they need double protection. No? They're victims already, so they need protection from whatever it is that caused the violence. And then they need protection because of the risk of the research. I failed to mention privacy and confidentiality. You know, there's that risk of stigmatization if people know that you're a victim. Pwede kang pagchismisan, no? Pwede kang hindi isama sa social circles. No? So there's that risk. And then it's actually triple protection because not only are they at risk of the violence, the risk of the research, but at risk for COVID as well. So why are VAC and VAW research participants at risk? Don't forget that they are scarred. And whenever you interview them, they may be re-wounded. Actually, the term vulnerable comes from the Latin term vulnerare, meaning to be wounded, vulnerare, which means a vulnerable population literally is one that is easily capable of being wounded. So all research participants, especially VAC and VAW research participants, are vulnerable and they need triple protection. Baka kung COVID, quadruple pa protection. Participants need protection from the harms of research and the harms resulting from the research. And this is very unique for VAC and VAW, for violence against children as well as violence against women. What's the harm of the research? I already mentioned, when you interview a victim and he relives the experience, then he's wounded all over again. He's harmed all over again. So you have to be very selective about the participant and you have to be very conscious about providing the extra protection that is necessary. Okay. What are the harms resulting from the research, particularly in VAC and VAW? Don't forget that some of the perpetrators, I'm sure you know this, I learned this from you, Bernie. Some of the perpetrators may be the family members themselves or somebody close to them. So if a family member discovers that a child has been included in a research, then that might lead to even more violence. And that's not, of course, that's not. Okay. So the research itself can lead to harm. All studies have potential for harm, but not all studies have benefits. So it's all about a risk-benefit assessment. And one of the most important parameters or one of the most important considerations that might lead to disapproval of any study is if there is an unfavorable risk-benefit assessment. So not talking about VAC or VAW, I'm sure you're more knowledgeable about that than I am. But there are a lot of researches where the claim of the researcher is that the harms are minimal. For example, a study that requires just a blood draw. Let's say it's an epidemiologic study. You just want to know the prevalence of having this protein X, and then you'll get people and you'll do a blood draw. For studies like this, the risk that you may incur from a blood draw is even higher than the benefit that you will get from the conclusions of the study. So even if that risk is very small, an unfavorable risk-benefit ratio can lead to disapproval. So all researchers have to be conscious about having a favorable risk-benefit ratio. And for VAC and VAW, that means that your responsibility has to go beyond the research. The consent procedure, in VAC, no, the consent procedure itself may be harmful. I'm talking about children. Because when you get consent, you'll get consent from the parents. And the parents themselves may be involved in the violence. So here is where research committees have to be conscious about waiver of consent or the use of advocates or surrogates. I remember very distinctly that many years ago, we weren't very conscious about this as yet, and the UNICEF came up with a study among street children who are already institutionalized. And that was when we had a very long discussion. I think for that one protocol, it took us 1.5 hours of discussion on how the consent, on whether the consent is required. Later, we decided that the consent may lead to more harm. So we actually allowed for waiver of consent, but we created, excuse me, a social harm committee, which is similar to a data safety monitoring board, who will review the study at regular intervals, like a monitor, no? like a monitor in a clinical trial, to see to it that the research participants are free from harm. And I think that was a model that was used by other research ethics committees when they had to contend with studies such as this. Then this is what I've been saying. No? The researcher's responsibilities and accountabilities go beyond the research. So VAC and VAW research shouldn't end with just the research, or we won't allow a one-time research for that. There should be continuing protection. That means we should look at the qualifications and the experience, of the researcher, and not only, and perhaps even the institution, the track record. Generally, we don't even allow undergraduate students to do VAC or VAW research. Kasi if they're going to be doing that for thesis requirements, who will take care of the research participant after their thesis is done? So we need to look at the institution where the researcher comes from, as well as the organization where the researcher comes from. That means that institution or organization has to have a track record that will ensure the continued protection of the participants even beyond the research. So, and I think my last slide is, research ethics committees are important, but even more important than the research ethics committee is the researcher. An ethical researcher is even more important. The ethics committee can only do so much. Our engagement with the research is very limited. Only at the start of the study and during the study. Once the study ends, then it's all up to the researcher. And I would like to emphasize that the accountabilities and responsibilities of the researcher go beyond the research. So with that, again, thank you very much for the invitation and congratulations to the two previous speakers, because I actually learned a lot. And as I've said, please allow me to invite you in future workshops.
Yes, thank you so much, Dr. Jojo Mantaring. It's always an enlightening, like Dr. Sandra, experience to always listen to you when it comes to our national ethical guidelines when it comes to research, especially those involving vulnerable populations such as women and children who have survived violence or continue to survive violence now that we are under the COVID-19
Dali
pandemic.
lang mga
So turning
kababayan,
over the floor to you, Dr. Mario.
ay di pinipilit. Pag
Okay,
nangutang ng
thank
ano,
you, Carmela. Um, so I will address the questions that I see in the Q&A box. There were two questions that I see. The first one is what could be the long-term impact or challenges that researchers will encounter, excuse me, considering that the pandemic may last for years. So any one of our speakers, but maybe Dr. Mantaring can answer that because he's talking about continuity and not a one-time thing.
Whether there's a pandemic or no pandemic, there should be continued protection of all research participants. I, I don't know if it's the skeptic in me as an epidemiologist. I'm not very uh, optimistic about COVID going away anytime soon. So we need to get used to it. We need to adapt. We need to adapt to it, and all our researchers have to adapt to this situation. For that matter, if a research is very important, don't you don't really need to postpone it until after COVID. You just need to adapt that research so that it will continue to protect the participant and the researcher as well as because of the current pandemic.
But related to what you're saying, the data is important, but the data should also be correct. It should not be gathered haphazardly or incompletely, because sometimes the information you get from those sorts of data collection will be even more harmful. Don't you think so?
Uh, I agree with you completely, and that don't forget that there's this concept called selection bias, and perhaps if you're very selective about your participants, those who are maybe COVID free, you may not get a very accurate picture of your research. Or if you neglect to go to some communities because they're uh, COVID prevalent, then you might neglect a very important cross section of your patient population.
I have at this point I have to disclose that Dr. Mantaring and I are both teaching research design and data collection in the Department of Clinical Epidemiology. So to some extent we are speaking the same alien language for some of you. Okay, thank you, Dr. Mantaring. There is a suggestion in the Q&A. Maybe we can incorporate a question or two on VAC, VAW in the medical records. This would reach a broader number of people, and also contact numbers for children, women's and children's desks could be printed whenever we have the medical records. This would lessen the exposure to COVID and other infections from other infections, and also from violent reactions. The survey could be covered by the general consent of seeking medical care. Maybe I can ask Dr. Madrid to respond to that.
Thank you, Mario. And I just want to greet Dr. Jojo. I am part of your disclosure, but we always go to him for advice with regards ethics, because if you are really very much involved in the research, you might also be biased about the ethics of it. So it's really good to have an outsider who is disinterested, to be able to tell you whether what you're planning is really ethical or not. Because if we say that what we're doing is for the benefit of child victims and survivors and women victims and survivors of violence, then we should not be doing them any violence by doing the research itself. So I truly appreciate Dr. Jojo Mantaring because we always go to him for advice. Now, Mario, I'm trying to actually, I also want to say that Mario is really the most appropriate moderator for today because he's an obstetrician, he's an epidemiologist, and he is in the advisory board of the Child Protection Network. So I don't know who fits the bill more. I'm trying to understand the question, Mario.
I think it's related to whether some screening questions for violence against women or children should
Okay.
be part in a regular medical record, either electronic or print medical record.
Okay. Um, I'm also part of, I was chair of the World Health Organization committee on the clinical guidelines for the health response to sexual abuse of adolescents and children, and also for child maltreatment. And a systematic review of all researches was done with regard screening for violence against children, just regular generalized screening for any victim of violence, both for children and women. And the result is that number one, it is not really advisable to just screen everybody. So we do not recommend universal screening. What is recommended is what we call case finding. Now, what is the difference? Case findings mean is that you should first recognize what are the signs of violence, whether against women or children. And if these are and if you recognize a sign that is suspicious, then that's when you start doing further investigation, but not that you will have a questionnaire that you ask somebody who comes in for a cold, you ask about violence. No, it's not like that. There should be a reason to suspect, before you start any screening or investigation. um, and also, of course, that means that all frontliners should be trained on how to do this recognition. But the ethics of that also is that if you do any general awareness raising and training people to recognize anybody that you have identified, you should be able to provide services. You cannot screen for something and not do anything or not offer anything. Okay, so it goes hand in hand. Okay, now you should also have services. I'm all right in having in the medical records, a source for referrals, so that people who now recognize, or suspects, they know where to refer. For me, that's fine. Okay, so but just to summarize, universal screening is not advisable, but case finding is. That means that all frontliners should be trained on how to recognize and how to refer if they don't know how to manage, but they should know at least the minimum, and services, should be available
So,
for
if
those that you identify. Okay.
so if the patient has a pasa or has a wound somewhere that is probably
Yes.
likely due to a real accident, that's when you only ask. You don't, and you have to be very, very careful that when you ask and you find something that you should be able to help. Hindi lang
Yes.
hindi lang information seeking, kundi talagang may gagawin ka kasi as what Dr. Mantaring said, you might be doing more harm because
Yes.
only
Oo.
perpetrating violence or something.
You might even put the child or the woman at risk if you identified pero wala ka namang ma-offer. Okay.
So the related question to that, it is very possible that, and it was mentioned, that some parents and guardians are the perpetrators of violence. In cases in like this, how can we possibly get the consent or the assent for the participation of the child in research? Maybe Sandra or uh, what's her name? Marianne
Marianne.
will
Marianne.
be able to Marianne will be able to respond to that. How do you get the consent if it's possible that the perpetrators of the violence against children are the people who will also give the consent? Mamaya ka na sumagot, Jojo. Bigyan mo natin ng challenge yung bata sa atin.
Si Bernie ang magsasagot niyan.
Mamaya. Marianne and Sandra, maybe,
Parang
wala na.
recitation pala to, sir.
Oh, Alexander, okay.
We won't know if they are perpetrators or not. So the important thing is to follow the protocol. When you follow your research protocol, then whatever situation you encounter in the household is you follow a standard. So the informed consent process really begins with asking for a household respondent. In our survey, the household respondent we are after is actually the mother. But if the mother is not available, then it can be the father, in succession, the grandparent or an older sibling or an other adult relative. And because there is a protocol, the consent, you don't try to force the consent. You just follow that standard where you introduce the study and you provide all the information. If the respondent is hesitant, there is an option of asking if you can give even more detailed information. And you cannot deviate from that. If the respondent does not allow, you have to respect that because the participation is voluntary. If the participation is not given because he is a perpetrator, then that is part of the informed consent protocol. We cannot.
Is it more likely that if the parents do not give consent, that probably they are perpetrators? I'm sorry if I am judgmental. So,
uh,
Yes, sir, probably. Yes, ma'am.
too much, okay? Sige.
Um, yeah, we already did this national baseline survey. That this was a national study in all the regions, and we actually had a high participation rate of 90%. No,
Parents give
and
consent, yeah?
parents gave consent. Of course, when we ask for the consent, there's as Cassandra said, there is the researcher in the field reads, what they're when we're through the whole thing, and we don't say we say all the experiences of children, from violence in the community, so everything. So we
So
don't
you,
just we don't just say specifically, that it's about child abuse. We don't use the term child abuse. We say their experience of violence in all settings, and also and the effects on health and safety, etc. Uh, in my own personal analysis, I feel that parents do not label themselves as perpetrators. They do not self-identify that what they're doing is violence against their children. I think majority do not have that insight. So they do give consent.
okay. So it should be an encompassing thing so that it's not threatening to them, because
Yes, yes,
otherwise they will not cooperate because like it makes them difficult, and it's really very good to have a um, broader base of what you're going to ask.
yes,
There's a
yes.
recurrent question in the chat box. Maybe Dr. Mantaring or Sandra or Marian can answer. How about giving incentives to the participants of the study as to what is the extent that is not allowed or allowed?
All sorry, all incentives uh, should be disclosed. So all incentives should be disclosed in the protocol and the informed consent. And the job of the ethics committee is to make sure that these incentives will not be uh, considered undue inducements. Because some of these incentives might be too high, So parang the participants are now joining not because that they want to contribute to the research, but because they want to get the incentive. So yes, it's appropriate to give incentives, but they should be age appropriate and they should not be so high to be considered an undue influence.
I have a question for you, Dr. Jojo.
Yes, Mario.
Is it also right? Is it also okay not to give an incentive at all? Parang
Yes, it's also okay not. It's also okay not to give an incentive because if that's in the consent and the participant sees that there's no incentive but still chooses to participate in the study because of genuine contribution to science, then that's okay. Pero if there's no incentive, some participants, I mean, quite truthfully will say, there's nothing in it for me, so I don't want to join. So it can also discourage participation.
Kasi nga, nagpumunta na nga doon, pamasahe, oras, malis sa trabaho, tapos wala man lang parang reimbursement, that makes it difficult for them.
So all incentives, we don't even want to call it an incentive. It's more of
reimbursement.
Sometimes no, it's a bother fee, parang ganyan. It should be worth kasi the bother. So they have to justify. For example, if they say, I'll give you 1,500 per visit, it has to be justified. That will cover transportation, maybe transportation also for a companion and lost meals, which is reasonable. So ganyan. So it has to be reasonable and justified.
It is really difficult to conduct an interview with the victim, especially the perpetrators. Is a member of the family, and the mother is trying to shield the perpetrator. I think that was partially answered by Dr. Madrid already. And there's also I'm trying to look at some of the questions in the chat, in the Q&A. Is our government giving enough protection and support to our researchers? Maybe Dr. Mantaring can answer that, being in the SJREB, the Single Joint Research Ethics Board.
Actually, no, the government has nothing to do with the protection of the researcher. Okay. So, the researchers have to fend for themselves. In fact, sometimes the research will say that the PPE will be given by PhilHealth, and we have to question that because, for example, there was a research that was done to determine the accuracy of the rapid antibody test, and the researcher tried to pass on the expense to PhilHealth. We said that cannot be. That should be the participant's decision, because if he uses his PhilHealth for that test, he cannot use his PhilHealth for something else. So we actually disapproved that provision of using PhilHealth for that for the test. Anyway, that's just on the side.
Okay. Ano po ang ideal time frame para sa research, especially in the pandemic time? I don't quite understand the context of that question.
Maybe baka yan yung sinagot ni Jojo kanina. Oh.
Okay. So I think we've covered most of the questions already, and some of the questions are already answered in the Q&A. So maybe we can finish the Q&A, the open forum now. So I will now proceed to the summary and closing. Now, given the As what Dr. Madrid said, I will now wear my epidemiologist hat. And when it's as an epidemiologist and a researcher, we look up the original objectives of this webinar and try to answer found, if we have addressed the objectives. So what is the importance of evidence to guide research? So that was the first objective. I guess we have realized that evidence gathered, evidence should be on the findings, the conclusions, and the recommendations about the research questions. So we need to get it carefully and correctly. And carefully because the quality and the correctness of the data contributes as the evidence for the research. And and this evidence will be the ones used for making recommendations and policies. So what are the elements of data collection? So I think what we are doing right now, aside from face-to-face, is internet-based data collection, Zoom-based data collection. But the issue of training, especially new training, is being done right now because not everybody, well, last year we did not even do this online thing so much. Now it's practically driving our whole lives on a day-to-day basis. So the data collection should be safe, it should be clear, and what was mentioned, it should be actionable. If you're going to get data and you have findings, you should be able to do something about the data that you got. And also address what should be understandable. The people who are getting the data from and the people who will use the data from should understand what you're trying, the data you're trying to get. The ethical considerations, the issue of privacy, confidentiality, participant safety, the informed consent, and the staff safety were discussed. And the special issue, the special concerns about research in children was brought up because they're a vulnerable group and we don't want additional harm to come to them. And of course, the safety is not only for the researchers now, but also for the researchers, the data collectors. I think we can consider the research gatherers as frontliners as well. Then this brings us to the other objective on the safety protocols. So how to gather the data safely online, the language that we use. As much as possible, we want to have as little risk or no risk for the research participants and the researchers. And the risks that are involved are the risks of continued violence and the risks of the COVID. So double whammy pa rin. So we have to be very careful in terms of the safety protocols. We have to put in contact information as to what to do and where to go to in just in case we find something in terms of related to the COVID or to the violence. Where to go, what to do in case something comes in. And of course, we also mentioned the ethical and methodological guidance. And I think the discussions of Marianne, of Sandra, and of course, Dr. Mantaring were very important. And it's very understandable because we have to protect ourselves as researchers. We have to protect the participants of the research. And we have to protect society as well because we don't want violence against women and children to continue. So that summarizes what we gathered this morning, and I'd like to thank again for participating. So I bring this back now to
Thank you
Ornella.
so much, Dr. Mario, and thank you everyone for participating at our webinar today on research on VAC and VAW during COVID-19. So thank you very much for pledging support for the child. See you next week. Maraming salamat. Bye!
Alang sa pag-ibig, gagawin ko ang lahat.